Good morning, and thanks very much, and thanks to Derek and to Ken for the invitation to speak. I want to take you through some of the issues that are facing patient registries when it's coming to pural measurement. The background to this really is that in Ireland there is a spectrum of patient registries, those that have been around a very long time and to those that are only trying to become established. And I was fortunate to work with the MRCG earlier this year to write a report on how to develop registries. And one of the things we note in that is that this is an area that is very challenging, and we are looking to design registries of the future, and I'm going to outline some of the ways we hope to do that with the example of the CF registry. So I'm going to give you the experience of the registry because it's been around about 15 years now. It has almost all people with cystic fibrosis on the registry. So there's about 1,300 people on the registry. And what registries do, you'll probably be familiar, it collects information from medical records that are available at the hospitals the patients attend. And so information such as hospitalisations, treatments and clinical outcomes that the clinicians and the medical team record are captured in hospital charts and lab systems. And that is the information that is collected by registries at the moment. The really big challenge for us and for all registries is capturing information that is of importance and information that matters to patients in terms of the benefits they receive from receiving cystic fibrosis care. So I want to just touch on two particular areas as I move on in a minute, but when we're thinking about designing the next generation of registries, we really feel it's very important to include and measure patient-reported outcomes in the registries, but we don't know how to do it. And we are at the early stages of figuring that out, but we feel two areas that we really want to address, and we are trying to address through our ongoing initiatives, is figuring out what needs to be measured and what is important to the patients and their families, and how will we capture that data. So the first example I want to give is one of our initiatives that's going to be starting shortly. And we're undertaking a value-based healthcare study in collaboration with Boston Children's Hospital and Harvard Business School early next year. And just this week we have formalised our research studies design. We're going to be working with Professor Bob Kaplan in in Harvard Business School, along with UCD, Smurfit Business School, ourselves and our colleagues in the Boston Children's Hospital. So one of the things we're hoping to understand and what we're trying to learn through this process is what are the patient-reported outcomes that matter to patients, and we hope to be working with ICHOM on that particular area. We're trying to understand the process of care, the clinical outcomes that are important to that, and finally the resource use and the cost involved in that. And so we believe that there are a lot of learnings that we can derive from this process, from Boston and from this particular endeavour also. So this is an exciting project that's about to kick off. The second thing is, how do we go about capturing this information? And this is a study that we conducted over the last number of years where we developed a patient portal, which is essentially a window for patients who participate in the registry to get access to their own information. And this was an app that people could use on their desktop or their mobile phone called CFView. And they could log in securely and access information we had captured on the individual, or the parent. The parent could log in if it was for a child over the course of their treatment for CF, from the time point at which they consented to the registry. And so they found it very useful, particularly as they share care amongst different hospitals, and they can use that and log in. So this is the first stage of development, and we feel it's very important, and it's an important tool to empower the patient and to provide transparency also. We feel that this is a potential way moving forward, and when we design registries of the future, to get information on patient-reported outcomes. So if we flip it over, we have currently at the moment an app which can push information out, and we're looking to the next iteration where information can be captured through this particular patient portal. So I think it's really important that information through the patient is captured through patient registries. There's a lot of clinical information out there that we have, and it could be made even more valuable if it was put alongside other really important information such as the patient-reported outcomes. So I think I'll conclude there. Thank you.